this invitation, and I'm very glad to participate with you on this very important topic, which is the climate change. Now, I think that we can change a little bit the cap, and we'll talk about another axe in the aquaculture sector, which is the aquatic diseases. So my participation today will focus on how is this climate change considered as a threat or not for an increasing incidence of aquatic disease? So this is a picture of my institute. We are in Tunisia, we are in North Africa, and we are mainly in Carthage. So one of the topics that we are dealing with is we have a platform for fish pathologies, diagnostic, and research. And this is how I participate with Etienne and Niveen. Generally. So I will classically start my introduction by saying that aquaculture is not more an option, it's a solution, as everybody is convinced today. So it's a solution for the overfishing, it's a solution for food security, as FAO data clearly shows that by 2030, 62% of the seafood consumption will come from aquaculture. This will contribute to more jobs and to reduce a little bit of poverty. And generally talking, and more specifically, if we take the Mediterranean example, it's the aquaculture is very diverse. We have plenty of species, we have different farming systems, but I can also say that each aquatic species will be affected by a specific pathogen, and this can hamper the very nice goals that everybody is working toward, the efficiency, the sustainability, and the resilience of this sector. Unfortunately, we can say that disease can threat not only the economic income of the fish farms, but also the jobs of nearly 60 million people employed in the sector. So fish and fish products are #1 traded products all over the world. There's a big movement. This is an example of the fish juvenile movement within the Mediterranean. And it's an intensive activity. Like all intensive activities, the aquatic animal diseases will be one of the most important constraints in the sector. And with the movement of fish, there will be movement and emergence and re-emergence of transboundary aquatic animal diseases. And this will cause a big problem for the sector. And that's why the prevention measures have to be not only considered at the farm or a national level, but also at a regional and transnational level. So this is what we know, or this is what we are doing. We are farming fish species in cages or in basins, but it's always open or semi-closed systems, where the treatment should be considered by caution, because also we are facing other problems such as resistance to some antibiotics, and we are transferring these genes of resistance. We have a limited number of vaccines available in the market, so the vaccination is not always possible when the disease to prevent the disease. So the control measures are mainly based on a preventive way, on an early diagnostic and a master plan for biosecurity, and the development and the building capacity on the surveillance tool. So mixing all of these together, they will. We are trying to reduce the impact of these diseases, and that's why I wanted to talk about the impact of disease in aquaculture before moving to the impact of climate change. Sorry. So we can have direct and indirect impacts. So the direct impact is very easy to see because we can clearly watch the mortality. We can have or evaluate or estimate the lack of profits once in a year, but sometimes we have low performance, we have more costs per year because we are giving more food, we are calling more vets, we are giving more treatment. So these are costs that are very difficult to estimate, and together with the direct cost, they will they will form, or they will give us the general economic impact that the fish farm are facing. And for just an information, on a global scale, animal disease outbreaks cost the aquaculture industry more than $6 million per year. So this is a nice overview done by a French colleague on the Mediterranean aquaculture, marine aquaculture, over 40 years. And we can see that we have the impact, or we can see that the diseases goes really in parallel with the production. We have classic diseases. We have also the emergence of new diseases. We have the introduction of new treatments. And in each step, we can see that it really influence the production and the growth of the aquatic sector. In general, we can say that we have a fluctuating epidemiological profile for the Mediterranean aquaculture. For example, we have our very known pathogens that we are routinely dealing with, and also we have new pathogens, and these are really very related to the changing in the environmental conditions. For example, we have notavirus, which is a very important, economically important viral infectious in sea bass and sea bream fish farms. And apart from the 4 genotypes that we really know how to deal with, or we are used to, we have since 2017, for example, an emerging of new reassortants. Again, in bacterial pathogens, we have new virulent strains, and they are really dependent from the temperature changing. So the climate change can be considered or not as a supplemental risk factor for the emerging of these diseases. And for us, disease is a threat and the climate change is a threat. So how are these two threats will converge in the future? So for aquaculture, the global warming means a change in ocean productivity, in water temperature, in the appearance of extreme weather events. I will not repeat what's already said perfectly, but this is really important for the fish which are farmed for the human consumption, because they are poikilothermic species. They are very dependent from the external conditions, and this can significantly influence their metabolism and also their susceptibility and their resistance to the disease. Yes, we can be a little bit positive, because depending on the climate zone, the impact of aquaculture, we can say, or we can have this question, could it be positive or negative? Could aquaculture, or could, from the epidemiological, of course, point of view, could aquaculture can be a climate smart adaptation for this climate change, or anything of this in this sense? But to answer this kind of questions, we have to understand and examine how these aquatic pathogens respond or will respond to the climate changes. What we know is that the climate change will induce the environmental stress, higher temperature, lower salinity, or higher salinity, and a change in pH, a change in oxygen, and all of this for us is a change in the environment, which will increase incidence of the disease, the rate of transmission, the mode of transmission sometimes. So it's a significant influence, because global warming is gradually increasing the water temperature. This will pose a problem, because sometimes it can lead to more virulent or more stronger pathogen in a more weak or a weakened host. So maybe 3 topics we can go in depth is the distribution, the climate change effect on the distribution of the disease or the pathogens. Species will move, so the disease will automatically move. So now, for example, we have notavirus. It's it's my favorite virus. So we have this change in distribution. We are now going to higher countries in which we are not used to have notavirus there, because of the increase in water temperature, the prevalence, the frequency of the disease, the length of the outbreaks, the virulence, these are all really dependent to this fluctuation in the environment condition. However, to date, and compared, everything is relative, but compared to other topics, we have a scarcity of long-term data, and that's why we cannot really precise the impact of climate change on the emergence of these diseases, because it's really difficult to predict because of the complex interaction of all the process. There are, of course, useful references, and there are more, but compared to other topics, we still have a long way to go through. So one of the good examples that I found, it's a British study, and it's on Vibrio species, a marine species, and we can say that these species, the Vibrio, are very a good barometer for climate change, because, for example, they are found in a low salinity water all around the world, and they prefer warm water more than 15 degrees. And if the water temperature will increase, so they can provide a good model to assess the global warming in some coastal zones. Another example that I found is a Korean study, which are researchers are forecasting the impact of water temperature on some of the fish viral outbreaks. For example, the Red Sea bream iridovirus and the gallinovirus, which are very important viruses in warm water, and they can be impacted negatively because if the water temperature will increase, then the outbreak can come earlier, and also it can persist for a longer period. And here we can talk about a higher economic loss. However, if we take the example of viral hemorrhagic septicemia virus, which is a cold rhabdovirus, and the disease is generally occurring under 18 or 15 degrees, then the outbreak can be even shorter, and this is a positive effect. And one of the rare examples on studies for long-term interaction between the temperature fluctuation and the emergence of microbes is an assessment done in 2 fish farms in Finland during 20 years. And of course, what they saw is an annual, of course, it's an increase in annual mean of water temperature during the period, and that the prevalence of the infection, which is the percentage or the proportion of positive fish tanks on the overall of the tanks in the farm, it has 2 patterns. It increased in some of the diseases, and it was the opposite in other parasites, for example. So the effect of increasing water temperature on aquatic disease dynamic is certain. However, the role of local conditions is very important in determining the direction and the magnitude of the effect. So how are we managing, or how are we going to continue managing the health in our fish farms? Well, traditionally, we used to react. That means that we have the pathogen, we see the expression of the clinical disease, we diagnose and we treat. Even now, we are not doing in that way. We are moving toward a more integrated and systemic approach, and this is also the core of all of the international organizations' strategies, new strategies like the FAO or the World Organization for Animal Health, which is more based on risk assessment, biosecurity, surveillance, sustainable treatments, and also the well-being of the species. So we need to manage in this way. Also, some farmers may go to more dramatic means. For example, they can change the cultured species. This is an option, but from a pathological point of view, this means also that we can induce, or we can have more transboundary disease emergence, because the new species, they will come from the wild or from another country, and so we will have a new cycle of diseases or pathogens which are not used in that geographical location. And also another solution can be to move the cages to cooler places or to deeper water, and these are just solutions that are starting to be considered. So to conclude, we can say that life underwater is also sensitive to the changes of the world that the world is going through, and that apart from what we are facing from unregulated trade or from unsustainable farming practices, also the climate change is a supplemental risk factor, I think, to the emergence of the disease. And it can be in freshwater and also in marine water. And here the diseases may be powered by this climate change, and this will be much threatening because we have more selective virulent pathogens in new geographical distribution, and this will be really a threat to the global production and the food security. So, as I said, there's a paucity of the information as how to work with this or how to deal with aquatic animal disease and the climate change factors. So we need to work more on understanding of this interaction, on mapping new potential risks, and especially on the identification of suitable mitigation intervention strategies within our future research